Welcome to our YouTube channel Vikiran Drishti. Today I am live with new lecture series in Radiology and Imaging Technology. Those who have not subscribed this yet, please quickly like, comments and subscribe so that you keep getting notification of all new videos. Let's start now. Today the topic of my lecture is history taking. History taking is a process by which the health professionals collect the information by asking specific questions to the patient with the aim of formulating a diagnosis and providing medical care. Taking a history from a patient is a skill necessary for any diagnostic examination. It takes practice, patience, understanding, concentration and good communication skills. First of all, introduce yourself. What is the good history-taking approach? First of all, ensure that the consent has been gained. Maintain the privacy and dignity of the patient. Ensure that the patient is as comfortable as possible. Summarize each stage of the history-taking process. Involve the patient in the history-taking process, not just getting the answer. Let them to participate actively and to let them answer the question comfortless. What are the components of history taking? The first component of history taking is patient's profile. Second is medical history and surgical history. Third is past medication history. Fourth is menstrual history. Fifth is family history. Sixth is personal and social history. The patient profile history include date and time when it is acquiring the history, name of patient, age of patient, sex of patient, religion of patient, marital status of patient, occupation of patient, address of patient and the data of patient who gave the history. The medical history and surgical history include about the chronic disease. Is the patient is a known case of diabetes mellitus, hypertension, ulcer, T.B, asthma, any previous hospitalization, any operation in the past, include any gynecological sex. The past medication history include write whether the patient is on therapy or not. Is he or she is on or have on antibiotic, radiotherapy, allergy to penicillin, aspirin, sulfa drug, psychotropic drug, blood transfusion, vaccination, steroid. Write menstrual history which include age of the menarche, age of menopause, amount of blood loss, amenorrhea, abortion, fetal loss, normal vaginal delivery, cesarean section. Family history. It includes like number of sister, brother, daughter, sons and their health. Are the parent alive or not? Are they relatives or not? Any familiar disease. Personal and social history. It includes whether patient is smoker or not, alcoholic or not, is they have any special habit, bird collector. What is the economic and nutritional state of patient? Living in large or small place. Water supplementation, tap, river water. Residing in rural or urban place. Is there any domestic animal? Level of education. Marital state.